Talk to Stephen Hoffman.
Thank you, Dr. Antonucci, for your excellent talk, and especially your 400 patients experience. I have only a few of these patients, but I wanted to ask, in schizophrenia you have certain symptoms we call positive symptoms, like hallucinations, like paranoia, these things, and also delusions, and so on. In those young patients you have to ask for it, but I started with patients with schizophrenic symptoms and a history of autism. And they had vivid hallucinations, more visual than auditory, but they were also sometimes catatonic. Well, one of them had echolalia, but in children echolalia is not very frequent, so it's one of the children recognized as schizophrenia. But in my patients, there was some hyperactivity, but I used much bigger doses. So, well, I started very low as a DBP, granules I used already before, or mucosity, but also in schizophrenic patients, somewhat elder age. I started just as once a week, a quarter, once a week, 1/8 of a meal, and I didn't have problems. But in the younger kids, I started these points. But after time, I started with 1/8, 1/4, and I have not much problems. What is remarkable in your study is, did you have hallucinations? Because I was so happy, the hallucinations vanished like snow, you know, for the sun. And that's what I had to ask about it. Like a patient of mine, he didn't say, I hear voices or I see things. Only his mother said that. And then I asked him, he said, yes, I see. But after he was treated, he said, well, I have no more of those hallucinations. When I take something, it stays normal there. You see? So I try to pick something from the floor. It doesn't change, you know. Some things like that. It was remarkable that you don't have regressions after a certain treatment. They stay at the same niveau, same level. But our colleague Guernsey told that 75% of his patients had to move on with the treatment. I think that's not, that doesn't support with each other. And you know also that your patients, 82%, were improved, just like our colleague Guernsey. Well, that's something to find out. I have two small, perhaps 14 autistics, and I started with 22, 23 years old, and 165 who was more autistic than schizophrenic, perhaps. Well, it is the same disease, I think, more in the development phase and another phase of life. When you saw over a psychiatrist, I'm more interested in epidemiology, I'm more interested in the symptomology field.
I don't have a schizophrenic patient using Gc-MAF. I would like to do that, but I have seen schizophrenic patients go better with gluten-free and casein diet, for example, which is the first application of this diet. If you see the research, maybe 30 years ago, the first application was just schizophrenia. But I would like to try schizophrenia, but I don't have many patients. My 90% of patients are autistic children. Thank you.
Thank you very much.
Thank you.
Yes.
I have a question. Out of your 90% of the cases which you are autistic, how many of them have seizures? And what has been the effect of Gc-MAF on reducing the seizure for your children?
Repeat again.
How many of your children have seizures?
In my experience,
Yes, of the autistic.
maybe 30% of my patients have seizures.
And of this 30%, how many of them improved on just the seizure reduction?
Gc-MAF?
Yes.
I don't have data about this. I didn't check. But my feeling is that I didn't see children with seizure get better using Gc-MAF.
You did?
I didn't.
You did not?
I think no one reported me that the seizure was getting better.
So the seizures pretty much remain the same
children with seizure and check about that. Because, you know, for seizure, a lot of these children, they have already medicine, anti-epilepsy medicine.
Right. In my case, my son...
And in one case, I have children getting better with Gc-MAF for 8 months, then they stop Gc-MAF and they start to have seizures.
And then have seizures before they start.
And then they give again Gc-MAF and the seizure disappear.
When he stopped, you start seizures, isn't it?
Yeah, but because maybe they could come, I don't know. It's the only case that I have. You know, it's very likely to have a seizure. But he was getting better in many different files using Gc-MAF before.
Can I ask one question?
Quick one.
Quick one, quick three. I just want to know if you know some supplements and some other treatments with the Gc-MAF. And have you heard about the cannabinoid receptor in the liver? That they say that it's the cause of some children has to be in the Gc-MAF for a long time or for forever. And there is something to do about it. You know something about it?
No.
No. Have you used choline with the Gc-MAF?
Acetylcholine,
Phosphocholine?
phosphocholine. I use a lot of cytokine. I feel it could be effective. It's one of the other treatment that I feel effective for language and expressive language.
With or without Gc-MAF?
CDP choline.
CDP choline.
Or
With
cytokine.
or without? With Gc-MAF or without?
Just separate.
Just the choline.
Another tool.
Have you heard about that or electricity treatment? And how does it go with the Gc-MAF? It's supposed to be the same effect in the news.
Which kind of treatment?
Zap, some kind of electricity.
Zappa.
And low electricity.
I don't know.
It's a low voltage.
Low voltage.
Low voltage.
Electric stimulation.
Yes.
I tried with 5 children because it was someone that gave me a machine and asked me to try, but I didn't see it effective. I'm going to Los Angeles to try resonant magnetic treatment with some patient. I think it's more effective than electric stimulation. But you know, in St. Petersburg, there is someone that's using electro stimulation very well. But it's something that...
Can I please stop the questions now? Because we have 3 doctors of autism here, and you can speak to all of them one-to-one here right now, outside having coffee. Thank you very much, Dr. Nicola Antonucci. I'd like to ask Rana Bibi to come up here and say a few words, please. We haven't been treating autism in Dubai very long, so at the moment we only have 1 child who's gone back to school. But Rana's child has made some progress.
Thank you. Hi everyone. How many parents are here? Good, okay. This is, I think, just to give you a bit of hope. My son, 9 years old, classic autism, severe. We started 9 months ago giving Gc-MAF. I didn't expect much at the beginning. In 1 week, he got calm. Next week, he got much calmer. On the 3rd week, he was a different boy. We suffered so much from his aggressiveness, lack of attention, stimming all the time, doing dangerous stuff. It was hard. But now he's a much calmer child. He plays with his sisters all the time. He meant things, he's asking for things. He asks to see his dad and to play with his sisters. So it changed our lives. it's we're blessed. Thank you. I have to say, I feel like I'm one of the old moms who started this. So now that after 6 months actually of starting the treatment, we went, every day was better than the other, and then we went into a plateau, basically. So that's something that worries me a bit, because I just need to investigate more. Are we missing on anything? Is there anything more that we can do to guarantee the progress?
Apparently that's one shot of LDN.
LDN.
If he's on a plateau, one shot of LDN and he should go up again.
Where do I get that from?
I can tell you.
Thank you very much.
What is LDN?
Low dose naltrexone. It actually blocks the action of GcMAF, so we don't normally recommend it. But Dr. Zoya Vitenko told us that when the GcMAF seems to stop working, she gives them one shot of LDN, which sort of resets the immune system, and they continue on an upward path. So lots of people here know about LDN. Just take it once.
I'm not so sure that it blocks the reaction of GcMAF. It is meant, it was found by a psychiatrist in the United States that is alcoholic patients had amelioration of their autoimmune diseases. And then he thought, well, perhaps it has to do something with our own endorphins. They go up if they give them during the night. That's to be sure. The natural killer cell count is going up. That's interesting for cancer, but perhaps not autism. But it is not blocking. In my case, it's not blocking. I use it only 1/10.
Well, we understand that LDN blocks the immune system. So if you take it once, as they go to bed, it blocks the immune system overnight and seems to reset it. But you'd have to talk to Dr. Zoya Vitenko about that. Peter, would you like to come up and say a few words, please? Peter, how many years ago did this start? 4 years ago. Anyway, he was so close to death that his insurance company paid out the $300,000 so that he could distribute it before he died. He waited until the check cleared, and then he started the GcMAF.
Thanks, David. It's a wonderful conference, and I hope you've all enjoyed it as much as I have. It's I'm supposed to have been dead a few years ago. I had colorectal cancer spread through my peritoneum, in my lungs, and 2 big golf balls in my liver. About a year ago, I came home to Sydney after only about 12 weeks of therapy in a German clinic. And all my disease had disappeared. And I couldn't believe it. This is a CAT scan at exactly the same hospital. So that was what I thought was my miracle. The fact I'm speaking here today is my miracle. And we've heard of other miracles in the autism field. And I'm convinced in the healing capacity of the human body. I've experienced it myself. Many doctors here have seen it in a lot of their patients. And many parents are seeing it in the simple miracle of their child speaking. So I had my miracle, and the amazing thing for me, over the next 12 months, I've had 2 small recurrences in my liver. They were each preceded by an infectious event, a chemopoid infection. So I am very interested in my survival. I know many of the doctors here and all the presenters of the last conference. I'm an immunotherapy junkie. I go to immunotherapy conferences around the world. Dr. Stonkler is one of Germany's best doctors. I know, in my opinion, all of the best doctors in the world for me. I have a wonderful medical team. GcMAF has been with me every day of my healing. In fact, the doctor who introduced me to GcMAF is here, Dr. Ian Rafter in Sydney. And I'd like to ask you just to think of one question. He gave it to me, so I've got this wonderful product, I've just learned about it at a conference. He injected it to, he said, "Do you want it?" I said, "Of course." I never asked the price. I've learned now it's good to ask the price. But on price, I know a lot of other patient friends, and many of them are dead, have spent a lot more money on other therapies. And my heartfelt advice to all of my cancer friends in particular, and even to my autistic friends, is GcMAF is a worthwhile investment. It's so cheap in comparison to other therapies. I'd also suggest that you have to do the diet. I'm obsessive about my diet. I'm so strict, and it's so easy for me to be so strict. And I think even the capacity to be so strict is a benefit of Stephanie's yogurt, because of the effect that GcMAF has on your brain, your focus, your clarity. There's this synergy and healing that happens when you've got willpower and hope. So where do I get my hope from? I actually get it from coming to these conferences. On my table I've left 4 vials of my GcMAF that I'm taking home for the next 3 months. That's my Christmas present. I wouldn't leave this conference without some effective medicine. A lot of my friends are dead. They're beautiful people. We all choose our path and this wonderful life that our God's given us. But we have to choose very, very carefully. And when we make our choice, we have to have absolute commitment. And David gave me some good advice. He said, keep it simple and focus on GcMAF, the diet, and live a good, joyful life. So I'm going to go home and scuba dive. That's what I love to do. And enjoy my beautiful kids and my wife. And so I have hope. I've seen so many people overcome illness and live a good life. And I wish that for us all this Christmas that's coming. And I have a very personal and crazy blog. I've tried many interesting therapies, and I've discussed it with Dr. Bradstreet and Marco. I've had dendritic cell vaccinations as well. My advice is try GcMAF. Go to the Switzerland clinic. That's what I've told many of my friends. Try that first. And then if that doesn't work, and if you really want to live, there are other options. The secret to my survival is not giving up while you've got life and a few dollars in your pocket. I make the yogurt. The yogurt is so easy to make. It's the yogurt I have made. It's been around the world. I keep the cultures going. I make it from hotel room to hotel room. And my friends that tell me they can't make it, well, I say, well, I know I've made that yogurt in more hotel rooms than any other person probably on this planet. And, you know, the power of the gut, you know, it sounds, and don't take me wrong, but you have to look at your poo. The answer to our health is actually in what we eat and what comes out the other end. And all the parents with autistic children know this, but it is so true. The best German, one of the other best German doctors is doing a stool analysis for me right now. I met him at the conference last week where Marco spoke in Germany for alternative cancer medicine. You can do the most detailed analysis and get absolutely amazing clinical results if you're willing to put the effort in, but you have to find the doctors. So I congratulate you. You typed in GcMAF into Google and somehow you've ended up here, which I think is wonderful, and I wish you all the very best. And I want to thank David and his team for the enormous contribution. I have a dream that I'll be speaking at these conferences for the next 10 years. I've invited myself. I hope I'm welcome. And I like to see, one day there'll be 10,000 people here. I really have that vision that our healing and our immune system will take us to that level, and our world needs that at this time more than anything else. So, all the best.
Thank you very much, Peter Trayhurn. I don't know how many of you have noticed, but this conference is being videoed very unobtrusively by Gemma Polvani, who ever so kindly flew out here to do it for us. But she has a slightly longer story than that. She doesn't know I'm going to ask her this, but I would like her to come up here and just tell us how she was before and how she is now afterwards. Gemma, very kind of you, thank you. Yes, I did. And put in a couple of numbers, a couple of facts.
Oh, hello, I'm Gemma. About 7 years ago, I was diagnosed with ME. It came on very suddenly, seemingly overnight, and I suffered with it awfully. I was in bed weeks at a time. I couldn't move, like physically couldn't move my muscles, suffered from brain fog, memory loss, etc., all those symptoms. I ended up missing about 3 years of school, purely because I was unable to move. And the lack of concentration was ridiculous. So I suffered with that. I took vitamins every now and then prescribed to me, which seemed to help but didn't make much difference. And it wasn't until about, I don't know, about a year and a half ago, because my mum also had ME. I'm not sure how she came across GcMAF, but she did take it, and seemingly overnight, it was like a miracle, she was cured. I saw the difference in her the next day, and it was absolutely amazing. I couldn't believe that it would actually happen in real life. So I said to my mum, I was just wanting a bit of what she had, you know, and she was a bit reluctant to let me try it at first, you know, being a mother and worrying and things like that. But I was very stubborn. I said I would rather just risk it and have the injection and go through with it than live like this any longer, because I had no quality of life. And took it for about 5 months, have a shot every 3 days, even to this day. And after 5 months, I just changed completely. I can go out for walks, I can do sport, I can do my hobbies, and I don't have to pay for it anymore. Before I did, if I did anything I wanted to, I'd have to spend a week in bed afterwards, which I didn't think was very fair. So now I just have a better quality of life, and to this day it's still making such a difference. I'm about 90% recovered, I'd say, and I relapse basically never. And I can always feel it coming on when I do, so it's in advance and makes my life a lot easier. So that's basically it, and I'm going to continue to take GcMAF, just because it's making me feel so much better than I have done in the past, and thank you so much. It's made such a difference.
Thank you very much, Gemma. She wasn't sufficiently confident to run the filming here, so we told her that my son Andrew would run it, and she didn't have to worry too much, but of course actually we just let her do the whole thing from start to finish. So interestingly enough, yes, Gemma's mum, Susan, had terrible ME CFS, and she was horrified by the fact that she was incapacitated in bed and couldn't look after her own daughter, Gemma. So what she did is she was determined to get better, so she took 1 shot of Gc-MAF, full shot, and then just 3 days later took another full shot. And because you shouldn't really do that with autism and CFS, you should start with very, very small shots and build up to a big shot. But she just wanted to be cured. and it knocked her sideways. It put her in bed so badly she almost called an ambulance. She wondered if she was going to survive. And 3 days later, she got up and she was cured. And that's the fastest we've ever seen an ME/CFS cured, and that's Gemma's mum. Well, it's pretty much the end of the conference now, but I'd like to tell you a few stories about Guernsey, where I live. We treat 5,000 people worldwide, and the results we get vary enormously. Perhaps 50% of cancer cases are cured globally. But in Guernsey, we cure 100%. And that is because we are sitting right on top of them. We only give them enough Gc-MAF for 2 weeks. And at the end of 2 weeks, we say, are you doing the diet? Have you stopped the sugar? Are you just eating white meat, fish and vegetables? In other words, doing all the things we say on the website that so many people never read. And, of course, we are able to get the sort of results that we got with Joan Spence, who you heard from earlier. I'd just like to tell you about a recent prostate Gleason 10 who came in to see us. So normally you get to prostate cancer Gleason 9 and then you die. But this guy actually made it to Gleason 10. I have never heard of a Gleason 10 being alive before. And he staggered in great pain. And he couldn't walk. He had sticks. He held all the furniture to get around the room. And we always put a shot of Gc-MAF into them before they leave. 1 month later, he was walking an hour a day. All his pain had gone. He had lymphedema on his legs. That's to say that on his calves, the cancer was pouring out of his legs, and he had body stockings to hold his legs together. Well, on the 3rd month, he came in and said, look at my legs. As good as my legs. So he was probably cured in 3 months, but we can't get the Guernsey health department to test him, so we're probably going to have to send him to England for some tests. And another chap who was Gleason 9 came around to see us. We gave him 2 injections. He went away and he called up my PA Beata, who's the one in the blue dress today, and said, all my pain has gone. Is that all right? She said, yeah, that's all right. And two weeks later, he came round to see me again and said, I've cancelled my appointment with Dr. Death. Dr. Death is what the patients of Guernsey's senior oncologist call him, because he tells them, well, I can give you chemotherapy and you'll be dead in such and such time. All the patients get the same story. You're going to die, I'm going to give you chemotherapy, which he does. He pumps them full of chemotherapy, he tells them they're going to die, and he's absolutely right. They die. So he said, I've cancelled my appointment with Dr. Death because I haven't got any pain anymore, and he was going to give me morphine. And I don't want any of that. So when he first came in, he had a face as white as a sheet. Now he's a healthy pink colour. Last time I saw him was in a restaurant shepherding a load of people to a table for lunch. We had a great chat, and we see these people often. We had them all round to dinner a few weeks ago. So I'm nothing like as well versed in autism as the people you've heard from today. So I get all that information second hand, but I do